it's not easy to just say like, oh, just lose some weight and then come back.
One person asked if there's any age limits when it comes to treatments with own eggs.
All right. So this is a bit difficult question. As long as a patient produces some follicles and they would like to give their ovaries a try, yes, they can try. But we have to be realistic. And by realistic, I'm not trying to say like we shall discourage them from their treatments, but we have to show them what the science can offer them. But if they would like to give their ovaries a try, yes, they can try after the age of 45. But generally, the success rates are so low that it's not so cost efficient. So if they have limited resources, I mean, instead of doing an IVF, egg donation may be more logical, but it's all based on their views or their point of view that they have to evaluate it, and then they are the ones to make that decision in the end.
Yeah. So it sounds like you'd consider cases individually, but you don't really have a set age limit.
No, because we had many patients before that in their like the 46, 47, and they got pregnant. Yes, the unfortunately the chromosomal abnormality risks are increased with pregnancies after they are achieved after the age of 45. It's unfortunately above 90%. But if they would like to try it and hope that they would be in the remaining like instead of the 90%, if they would like to try with knowing that, then yes, they can try that.
And what would you advise to patients who are maybe in their 40s, they haven't had treatment before, and they're considering own eggs? What would you advise they do? Are they welcome to approach you?
Yes, if they would, as I said, like if they would like to give their ovaries a try, they must give it a try, because they can always think about the egg or embryo donation as plan B. Yes, after the age of 45, it keep on the success rates keep on decreasing, but it's not that significant every year. So if they would like to try with their own eggs, after proper consultation, then if they would like to try, yes, they shall try.
Another person asked if there are any BMI limits at your clinic. How is BMI related to treatment outcomes? Is there a cutoff where you stop treating patients due to their BMI?
Normally, if a BMI, like the BMI is very, very important, and it changes the ovarian response to embryo quality and to pregnancy complications, etc., etc. So the BMI is important. And normally, as a clinic, if a lady is already having a BMI over 32 for IVF, we strongly recommend them to drop it below 32. For egg or embryo donation, we recommend them to drop below 35. And if they need a dietitian or a PT that could help, that would be way more healthier than just cutting all the nutrients, etc. It should be controlled. So that would be maximizing their success rates. So this is something that can be sometimes achievable, sometimes not. So it's not easy to just say like, oh, just lose some weight and then come back. It's sometimes frustrating, but we shall share these before we start the treatment, as I said.
And are there ways you can support patients with higher BMI to achieve that lower weight?
We generally don't have any dietitian at the clinic, but we, as I say, like recommend them to see a dietitian. We can also refer them to some in Ireland, but that's not just because they must do it, but if they have their own dietitian or if they know someone from a friend of theirs, etc., it's all fine. As long as it's a professional, then it's all okay.
Whether you are able to individualize the protocols to patients who are above 40 years old. I wonder, how do you approach that in your work?
So yes, we individualize every individual, especially if they are over the age of 40. This is not just doing some dosage adjustments, etc., but also some lifestyle changes as well. About the age of 40, we have to make the decisions based on their, as I said before, like previous history, their body mass index, their previous IVF attempts, if any. So accordingly, we individualize the treatment.
How about patients with autoimmune conditions? Do you have any immune protocols? I think a patient was mentioning arthritis specifically.
So unfortunately, none of the immune modulators or immunotherapies have some strong evidence, unfortunately. So the most important thing is a well controlled disease. So that's why a consultation with a rheumatologist in that case is important. And also we have to evaluate their medications that they are using. For example, in psoriatic arthritis, the patients generally use methotrexate, which is very, very dangerous during a pregnancy. So we shall evaluate it as well. But unfortunately, there's no such certain immune therapy or immune suppressive that we can just give and increase their success rates, unfortunately.
Mm-hmm. Yeah, thank you. We also had an interesting question about NAD plus infusions and how that correlates with improving egg quality. Do you have any experience with that?
No, but this is a treatment that is shown to be efficient in animal studies, but none of the human studies, randomized controls, trials have shown any benefit at all. So the benefit is uncertain in humans right now.
We had another question about what women can do to improve their success rate of IVF. Can they do anything to prepare or to reduce the chances of implantation failure? Is this something that they can control?
It is easy to say, but just like live a healthy life. In terms of that, just do regular exercise, but not excess, or not something like when we recommend them to have some regular walks, not like just shopping around, etc., just steady walk. Or for diets, just live a healthy Mediterranean diet. But by Mediterranean diet, let's not complicate things, just red and green vegetables and fruits. Instead of greasy, salty food, instead of butter, for example, use olive oil. Apart from that, yes, it's easy to say, difficult to do. Stop smoking, limit alcohol consumption, lower the level of stress. As I say, it's easy to say, but difficult to do. And control the body weight. These are the most important things that patients can change easily. But as I said, when I say easily, at least it's easier to increase the follicle count or increase the quality of the eggs they have.
We also had a question about the PNT procedure in North Cyprus. Is this something that can be performed?
We don't do it. We don't perform it as it's regarded as highly experimental. This is where the fertilized egg of the patient is placed on a dish, and the DNA is extracted and put inside a donor egg from which the DNA is removed. So it's trying to use the young mitochondria or other organelles of the cell by using the couple's own DNAs.
Okay. So it would allow couples to use their DNAs even if their egg quality is already poor.
Yes, exactly.
So thank you again for your time. It was lovely to speak to you and get your perspective on these questions.
Thank you for inviting me, and hopefully we managed to help some people.
Cheers.